Good morning, and welcome to the EASL studio, the Hepatology Broadcast News, live from the International Liver Congress. My name is Francesco Negro. I'm honored to co-chair this session with Professor Maria Buti from Barcelona, whom I welcome to my left. Let me introduce immediately our distinguished faculty. I'm pleased to have on my right Laurie DeLeve. She's a president of the American Association for the Study of Liver Disease and working at the University of Southern California. Welcome from California, Laurie.
Thank you so much.
And to my left, I have Manal Sayed from Ain Shams University from Cairo, Egypt, who's representing also the COLDA initiative for Africa. Very welcome to London, Manal.
Thank you.
And representing young investigators, Philipp Schwabl from Vienna University. Thank you, Philipp, for being here with us today.
It's a pleasure.
Maria, hand over to you immediately for some opening remarks.
Thank you, Franco. I would like to highlight today the EASL Lancet Commission. This will be at 10 o'clock, and I think it's really important because you can see the scenario of European liver diseases. So attend, please, this meeting.
Thank you, Maria. I think the Lancet Commission has been a huge achievement, funded and organized by EASL. It's really an important landmark paper initiative, which will certainly have a follow-up. I think one of the probably most important aspects, I don't want to downsize everything else, but I think one of the important topics which will be discussed today at the session is the issue of stigma and inequalities. I think my opinion is inequalities, I believe all of you agree on that, is a key word, is a major determinant of health. And we must be aware of this issue. And I would like to hand over, Manal, you are working with the COLDA and be working for the Committee for Access to Care in Egypt.
Yeah.
And you know exactly what I mean by that word, inequality in health access.
Yeah, I think it's a very important issue, and we've seen this in most resource-limited settings. Maybe Egypt was unique because we had a presidential initiative, we had a political will to eliminate hepatitis C, but the rest of Africa, for example, and I represent the Conference of Liver Disease in Africa initiative, is fluttering behind, and they cannot access care or treatment. And I think it's important that we partner together, the organizations should partner, and there is also a provider's role that we are all not looking at. The provider should improve access and should help in improving access. Working with the civil society is very important, and today in our session, the EASL called a session, we're going to discuss the role of the civil society to remove barriers to access to care and treatment. And there are lots of populations. It can be a general population or a whole country, or it can be a group of high-risk patients, including children and the pediatric population. So I think there is a huge role for organizations to start and push forwards to remove the inequality and improve access to care.
That's very important. I really underline this aspect. Access to care should become our priority now. You are chairing the Public Health Committee. You know this very well as well.
And yesterday the patient forum was also on stigma. So really stigma is really important for patients.
It's an important barriers to care which have to be overcome. Can I maybe ask also about, we are discussing not just access, of course, we're discussing science today. We have a lot of interesting interventions. Laurie, what do you think? What is going to be your pick for the day?
Oh, my pick is clearly the one, I'm sorry, Maria, conflicts with yours, but at 10 a.m. there's a session, a symposium for the EASL and EASD, looking at NAFLD and cardiovascular disease, extrahepatic malignancies, as well as cardiovascular, as well as diabetes, of course. And I think it's going to be very important because as hepatologists, we're the glue that holds NAFLD together, but unless we work with our colleagues in other disciplines, we're not going to make the advances we need to make. So that's my pick for the day.
That's very important. Uniting hepatology together with diabetologists, of course, they're going to be our privileged partners in this effort, of course.
Absolutely.
Any specific talk you want to single out from today's program?
Again, my other pick would be a symposium again. so the other symposium is liver-brain axis, excuse me, that I know very little about. So it's an opportunity for me to grow. They're talking about bile acids and satiety, which is very important for NAFLD again, as well as, forget what the other talk is. I apologize to the speaker, but I think the fact that bile acids have such an impact on the rest of the body is very interesting for me to grow intellectually, to learn about.
Very important.
Very important. And I think it's also one of the findings of the Lancet Commission, the increase in NAFLD and in metabolic liver disease, and also in Europe of alcohol.
And I think, well, I'm not a pediatrician, but I think the idea that we would have a whole generation of obese children, and we don't know what the long-term impact is going to be, and it may not even be that long-term. It's bad enough when you become obese as an adult, but the consequences of what happens in childhood with long-term NAFLD is very scary to me.
We're seeing cirrhotics at the age of 13 and 14 who need liver transplantation. So that's one impact that we are actually seeing as pediatricians.
Yes, this is quite a scary outlook, in fact. We are all concerned about these growing epidemics of lifestyle-related diseases, which are affecting not only just the liver, but the systemic diseases. It's clear. There are several presentations today. I will invite you to follow the growing public health impact of obesity and excess alcohol drinking. Please be aware of these issues. It's not just viral hepatitis, not just rare diseases, but clearly this is a huge epidemic affecting the whole world. Philipp, what do you think about today's program? What are you going to follow with more attention today?
I'm very excited to attend the late breaker session today. There are many interesting titles. We don't know much about the abstracts yet due to an embargo, which I think makes the session even more interesting. And as we just have talked about NASH, there will be 2 big NASH trials presented. On the one, there will be a phase 2b trial on semaglutide, and then a phase 3 trial on resmetirom, which is an thyroid receptor agonist. And so I'm very interested to hear more about those.
This is quite an innovative approach to handle NAFLD, in fact. Indeed.
Indeed.
It will be very interesting to listen. But it's also a very interesting presentation on alpha-1 antitrypsin. Have you seen that?
Correct, yes. I think it is important to also focus on rare diseases, and especially genetic diseases can be treated with innovative approaches like an RNA inhibitor. So I am looking forward to hear more about that today.
Great. With a late breaker at 2 o'clock.
I am going to share the late breakers session, and I think these innovative strategies are also used for hepatitis B. And there will be another important abstract looking at finite treatment duration using an oligoantisense nucleotide.
Exactly, yeah.
Indeed, so I invite you all to join that session today.
It will be exciting as ever. Late breakers are always a very engrossing moment of this meeting, of course.
And we shouldn't forget there are also HCC topics covered where you are the expert in the late breaker session.
That's correct, yes. We also have a GWAM analysis. That's quite, we do need this kind of approaches also to identify risk factors, genetic risk factors for cancer, for example. Yes.
Of course, it might help for screening.
Wonderful. What else can we invite our audience to listen? We have 5 clinical practice guidelines today.
Yes.
It's a huge, effort.
New clinical practice guidelines, in some of them in rare diseases. So I think this is really important for our community to have these guidelines and have uniform guidelines across European countries.
So can we remind also the topics? We have primary sclerosing cholangitis, hemochromatosis, new guidelines, cystic liver disease, which is quite a new thing. We've never done that before. Hepatic encephalopathy, of course, and also pregnancy and liver disease. It's a very important topic which has not been handled properly before. It's very important that you participate to these sessions, which I invite all members to join us for that. Quite new. So what else can we do?
There is also the journal hepatology session. I think this is also a nice session. And journal has a very high impact factor. And next Tuesday, we are going to have this year impact factor. So I think it will be nice also to attend this session.
By the way, this year we're going to be, for the first time, we're going to have an impact factor of a JAP reports.
Yes.
Our open access journal. For the first time, we'll know what is impacting the scientific community, of course. So be ready for that. On Tuesday, we will know all these new metrics of our journals. Yes. It's very nice, of course. What else can we say? I think we mentioned the symposia. There is a symposium of the foundation, of course, which is essentially emphasizing again, once more, the role of NAFLD, and I would say also the lack of global policies about NAFLD. There is inadequate, I would say, awareness of the problem around the world. And Jeff Lazarus conducted this a huge study with the foundation just to show how difficult it is to sensitize politicians on this issue. I think, what is your take in the United States? What is the situation?
I'll give a bigger take about this meeting and the global situation, and that is, of course, congresses are important to hear about science, but they're also very important for networking. And one of the things that has been happening here is that all the different major liver societies, ALE, APASL, ASLD, and EASL, have met together to come up with common approaches going forward. And I think that's very important on the world stage that we have a common voice.
Yes, I truly believe, a global issue requires a global effort.
Yes.
There's no question we must collaborate and put forces together to tackle this issue. It's a huge problem, NAFLD, and I would like to welcome again, the huge study done by Jeff Lazarus on this to collect all these experts globally to network and find solutions globally, of course. The first issue is awareness about it. It's clearly downplayed, I would say, or ignored until now.
Awareness and recognition by the WHO that liver diseases matter.
Yeah, liver diseases matter. That's a major step by WHO.
But not only WHO, I think awareness should also be coupled with a partnership with the media people, because that's how you reach politicians. That's the way we reached politicians when we established our program. And I think these are important partners as well that should be considered.
Last but not least, we have poster tours. We have interesting interventions. Also, the poster, don't miss that, because they are quite interactive. You can discuss personally with the authors. I would pick, anybody wants to pick one, a poster? We have had an interesting paper on the COVID vaccination, liver transplant. This is an issue, and these are problems which are not actually ending, unfortunately. Everybody has been meeting somehow COVID. I did it 2 weeks ago myself, and I'm cured now. Mm-hmm. It's a huge issue. We're not out of the wood, I would say. So, and this is especially true for immunosuppressed and vulnerable patients.
Frank, if you told me you just had COVID, I wouldn't be sitting here.
I was cured completely.
No, but there are several posters on this topic, COVID vaccination and response to vaccination, particularly immunosuppressed, immunocompromised people. And I think it's nice to see the results, and probably some of them will need another shot of vaccination.
Yes.
Indeed, I do love the poster tours and the poster exhibition, because there you can discover things that perhaps are not in the main focus. You can find ideas out of the box, and most importantly, you can also discuss it with the authors there very privately, and so I enjoy it a lot being there.
Okay, again, I'm inviting all members and all delegates to participate actively to these poster tours. They are quite interactive, quite interesting. You see young investigators discussing with enthusiasm the data. Please join us for that. And having said that, I believe Maria wants to do some
Yeah,
closing remarks.
I think it's time to wrap up. Thank you, Laurie. Thank you, Manal, Philipp. Thank you, Franco, for co-chair this session. For in-depth topical discussions, tune in later today for EASL Studio talks on rare liver disease. Live from the International Liver Congress 2022. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you.